Assalamualaikum and a very good day. In this video, we are going to talk about the waning of immunity after the COVID-19 vaccination. First discovered on 31st December 2019, a global pandemic caused by the COVID-19 virus has been affecting all of us till this day. Those who suffer from the virus may display symptoms such as fever, cough, tiredness, and loss of taste or smell. With the help of scientists all around the world, many vaccines were approved to be distributed to the public to help fight the virus. However, despite the fast development of the vaccine, scientists have discovered the possibility for the waning of immunity after the COVID-19 vaccination. So, what is meant by the waning of immunity after the COVID-19 vaccination? The waning of immunity after the vaccination is the decline in antibody level over time after receiving the COVID-19 vaccine, such as Pfizer, Moderna, and others. The waning of immunity can occur in two conditions, which are first, the lack of exposure to the COVID-19, and the high exposure to the COVID-19 virus. First is the waning of immunity due to the lack of exposure to the COVID-19 virus. A study was conducted to investigate the changing of antibody response after the full Pfizer vaccination. In the first week after full vaccination, the finding shows an increase in receptor binding domain antibody response with the ability to block the ACE2 spike protein interaction of the 5 variants. However, significant decline in antibody levels at 3 to 6 months can be seen after the second dose when there is a prolonged lack of exposure to the virus, which is expected, as all vaccine-induced short-lived plasma blasts do not necessarily differentiate into long-lived plasma cells. At 3 months, a decrease can also be seen for CD4 plus T cells as CD8 plus T cells senescence with time. Consequently, it also results in the decrease of the level of IgG and neutralizing antibody levels, which results in an overall decrease in humoral immune response against the virus after 6 months. Here is the evidence regarding the waning of immunity after the COVID-19 vaccination after 6 months. From this study, a decrease of immunity level in both severe and symptomatic cases can be seen, especially for the symptomatic cases. However, the efficacy of vaccines against severe disease after 6 months remain high to prevent the hospitalization and death, which are the main goal of the vaccination. Next is the waning of immunity due to the high exposure of COVID-19 virus. It is known that vaccines are not 100% effective in preventing infection. Infection after vaccination, or also known as vaccine breakthrough infection, are considered a common occurrence. However, vaccinated individuals who got infected typically suffered with minor symptoms and rarely develop a serious illness compared to those who are unvaccinated. In addition, risk for severe vaccine breakthrough infection increases for those with underlying medical conditions and older. A study showed that 96% of patients hospitalized with breakthrough infection had a pre-existing health condition, and CDC data also shows that 3/4 of those hospitalized with breakthrough infections in the US were aged 65 and older. But why do elderly and those with underlying medical condition are at a higher risk for the waning of immunity? For elderly, they are considered high risk because aging causes the production of B and T cells in bone marrow and thymus to reduce. Thus, the function of mature lymphocyte in secondary lymphoid tissue also begins to diminish, and over time, their immune system is unable to respond fully as before. Next, individuals with underlying medical conditions such as obesity, hypertensive, dyslipidemia, and smokers are also at a high risk of waning of immunity. The study shows that all individuals with respective medical condition suffer from a low antibody levels. It can be caused by a dysfunctional immune system for hypertensive and obesity patients, autoimmune disease and reduced response to infection resulting from smoking, and also the effect of lipid meditation for dyslipidemia patients. Waning of immunity can also be caused from an early infection of the virus before vaccination. A study was also conducted to see the prolonged effect of COVID-19 naive and recovered subjects' level of antigen-specific memory B cells and antibody. The study shows that for SARS-CoV-2 naive subjects, they required both doses of vaccines to reach an ideal increase in antibody, particularly for neutralizing of titers against the beta variant. After the second dose, the mRNA vaccine used for the subject showed an efficient development of specific memory B cells for full-length spike protein and the binding domain of the spike receptor. However, for SARS-CoV-2 discovered individual, their antibody levels and memory B cell responses significantly boost after the first dose, but neutralizing titers, circulating antibodies, and antigen-specific memory B cells remain the same after the second dose, thus resulting in a low level of antibodies and more decrease in their immunity levels compared to the naive subject. In conclusion, the waning of immunity after COVID-19 vaccination does occur and have been proven by multiple studies. However, vaccination does decrease the chances of severe infection of the virus, so get your vaccine today to prevent the waning of immunity against the virus. That's all from us. Thank you and have a nice day.